You have been given a prescription that requires an infusion. There are many things to consider when choosing where to receive your treatment. This module describes the 4 locations that can fulfill your infusion prescription, as well as the pros and cons of each. Main points to consider include cost of care, quality of care, and convenience of care. You have a choice of where to get your infusions. The 4 primary sites of care are your physician's office, the hospital or hospital outpatient department, a standalone infusion center, your home. Physician's office. Many times your specialist will offer infusions directly in their office. This can be convenient and comforting, as you already know the nurses and staff, you know that the office accepts your insurance, and you will not have to wait for your medical records to transfer. If you have an adverse reaction to your medication, your doctor's office will be equipped to assist you through the episode. The hospital. The hospital has 2 ways to administer an infusion: an inpatient center and an outpatient center. If your hospital only has an inpatient center, you will have to check in as a patient of the hospital to receive treatment. This process can be lengthy and expensive. For most insurance plans, the copay or coinsurance for a hospital is significantly higher than for a doctor's office. A standalone center. A standalone center, sometimes referred to as an ambulatory center, is a site of care that only administers infusions. They often have longer or more flexible hours than a physician's office, making it easier for you to receive your treatments without disrupting your schedule. Many standalone centers have private suites you can request if you prefer peace and quiet or privacy during your infusion. Your home. Home infusions are given directly in your home. Many times a service will bring the equipment and a nurse for your treatment. Home infusions can be convenient, and some patients report feeling less stress during their infusions when they receive them at home. However, not all medications or patients are eligible for home infusion. If you have an adverse reaction in your home, the home infusion service may not have as much equipment or support to treat your reaction as other sites of care. Costs vary by treatment site. Below is a table of the top 4 biologics by drug spend and their average cost per claim at each type of treatment center. As evidenced by these numbers, the hospital is the most expensive setting to receive treatment, with the physician's office typically being the least expensive choice. Choosing the right treatment is a personal choice. Here are several things to consider as you make your decision. Always discuss treatment plans with your doctor. Your physician may advise that you receive your first infusion in a facility to monitor for adverse reactions. Some insurers have preferred treatment centers or facilities. It is very important to consider your financial obligations at each site of care and choose a facility that you can afford over the course of your treatment. Some insurers require pre-authorizations or step therapy protocols for certain medications. It is important to check requirements for your specific plan prior to receiving treatment. Some medications cannot be infused at home. Discuss this treatment plan with your doctor if you think home infusion is right for you. Receiving your treatments on schedule is imperative to the success of your treatment. Make sure you choose a location that can accommodate the schedule or hours you are available to receive your treatments. The National Infusion Center Association has created the Infusion Center Locator to assist patients in finding a treatment center near them. Locator.infusioncenter.org. Still have questions on the basics of infusion? How to prepare for your infusion or any other infusion-related topic? Check out NICA's educational modules here. infusioncenter.org/education.